Welcome to the Healers Café, conversations on health and healing with Dr. Manon.
So welcome to the Healers Café.
Well, thank you.
Yeah, and I'm so excited actually that you've said yes to this interview. So let me tell the listeners a little bit about you, and then let's go for it.
Okay.
So we are interviewing here Dr. Thomas Ashton. He's been a medical doctor and particularly in general surgery for the last 40 years.
Right.
Which is a long time. And your interest in what you really, are speaking about now, and also in your books, is about that suffering has many forms. So I definitely want to go into that. But also I wanted to talk a little bit or ask your own journey, because you mentioned in your biography that, well, first of all, you introduced notions way back in South Florida that did not exist, like promoting medical supervised use of medical marijuana, and the whole notion of inflammation in disease processes.
Mm-hmm.
But as well, a lot of your teachings have to do with metaphysical principles that, of course, are taught. But I would love to know your journey and anything like that you would love to share.
Okay. Well, I've been a surgeon for 40 years. Came to South Florida in 1984. And at that time, I was freshly trained and ready to go and willing to do just about anything to get my practice started. And I believed in solo practice, so I didn't want to join a group or get into that mess. So, I took on a lot of responsibility in this county, in Palm Beach County, Florida, for anything that came my way. At that time, we didn't have trauma centers. And so my claim to fame was I was willing to do trauma. And at that time, most general surgeons were not willing to do trauma because there was a medical malpractice lawsuit crisis in Florida where the premiums were so high, and attorneys had inundated the state and was just going after everybody they could. So I became not only captain of the ship during trauma cases, but the entire crew as well. Wow. So fresh out of training, I was used to having 5 and 6 mentors and helpers during my surgical training and trauma fellowship that I could fall back on and get help. But here in 1984, I was it. So I had to dig deep into my training to survive that and help other people survive. So I can look back on it now and see why I never lost a patient. I mean, I've never had a lawsuit. I've never had any problem whatsoever. And I can see now what it was. And what it's very difficult to describe in a very short time, but what it amounts to is I became, out of sheer terror and necessity, I turned to not really my religion, but I turned to something that I thought was even more powerful than religion. I turned to metaphysical principles. And, to make a long story short, I've had a great career and I've done well, but now I feel the need to teach these principles to not only doctors, but everyone that wants to listen, because it was an incredible journey for me. I had some terrible times, some awful times. I was under a lot of stress at times and became very obese. I gained 50 pounds and I developed type 2 diabetes. I developed heart disease and all those terrible things that go along with that. So at this point in my career, I've developed an online weight loss course that not only is based on the latest research on how do you handle that, but also based on metaphysical principles. And I teach 4. You want me to keep going with this?
Absolutely. No, well, I'm really interested in that piece where I mean, first of all, it took courage to stand up and dare when there's, lawsuits everywhere, which, USA is renowned for.
Right.
But, to just be open to listen that there's more, and you introduce that. How did that come to you? And can you share a little bit, maybe a story specifically, or the first one that came to you so clearly? Like,
I have a big story about that, which was my baptism of fire. Actually, it's in my book, Living Above the Chaos, in minute detail, this story. But what it amounts to is my first day in practice, trauma call. I received a call about a 17-year-old female that had rolled her Jeep into the canal. Down here, everything's a canal. So, and the call was, Dr. Ashton, your trauma call today. We have a 17-year-old white female that is obviously dead on arrival, dead at the scene. We want to pronounce her dead and be done with it. And I said, no, we're not going to do that. Because of my ego. My ego came in and said, you are not going to lose your very first patient. You're just not going to let that happen. So I instituted the trauma protocol, and I said, this patient is going to be given a chance. And in my mind, I said, am I crazy? What am I doing? Surely this doctor knows what he's talking about. But something just kept me driving on and on and on. So I got to the emergency room. The young lady was almost unrecognizable as a human being. She was covered with blood and, very bad situation. And at that point, when I walked in the emergency room, my first mistake was walking through the entrance where patients' families wait. Because I wasn't that familiar with the hospital. I went in the wrong door. So there's the family. Oh my God, they just attacked me, said, doctor, don't let our daughter die. This is our only daughter. And I said, oh, don't worry, we'll do everything we can. And the father grabbed me and he said, no, she will not die. So I got my way through that, got into the emergency room, and I addressed her. I looked her over. She was still warm. What does that mean? She's still alive. So I did step by step through my training. The doctor there, emergency room doctor, came and said, look, Dr. Ashton, this is a for-profit hospital. We don't practice on corpses. I shoved them aside and I assembled all the paraphernalia that goes with all this trauma stuff. And I got my nurses and we ran down the hall with this patient into the operating room. And of course, the nurse there was like beside herself. She says, oh my God, are you crazy? So we put the patient on the table. I said, get anesthesia, get me blood, blah, 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 the whole thing you do with the trauma case. To make a long story short, she had just about everything busted inside her abdomen that could be busted. It was 2 or 3 8-hour procedures later that I was able to ship her off to trauma center in Tampa because I found the only neurosurgeon that was willing to take her. She also had a major head injury. So anyway, I was there in that hospital with that patient for 36 hours. This is my first case. Wow. In practice, in solo practice. So anyway, she survived, sent her off. Last I heard, she had 2 children and graduated from high school and has 2 children. So it took me 30 years to understand what process got her and myself through that. And it's an emotional experience when I relive it.
God, yeah.
But but it started me, onto this. Okay, I'm scrubbing at a tank, and what do I say? I say, I'm not prepared. I'm not ready. I turn it over to you. Whatever that power is, let's do this. Every patient from then on in my whole career, that's what I said before I did any procedures. Well, this concept needed, I'm not saying that, I became very famous in the community here because I was the guy that was always willing to take the case and be there. So it was very, very successful. On the other hand, I pretty much lost my family because I lived in the hospital.
Right.
At that time, I had 4 children. And that's a long story, too, of how I got through medical school when everybody told me that I couldn't go to medical school. But having 4 children and being 90% of the time gone, it takes its toll on them and the marriage and everything else. So I went through various problems in that way. And then tried to make sense out of the whole thing. How do you make sense of this? And so that's why I spent the next 5 years researching all the religions of the world. I ended up somehow, after a problem with a wife that became a drug addict, and things were going downhill, losing everything to that situation. I ended up on a trip to Teotihuacan. My nurse said, there's someone down there you need to meet. And that's another whole story about how I achieved an epiphany on the Pyramid of the Sun by being guided from this guide. And then I decided, I understood things at that point. And I understood that the only power that really exists and that is meaningful in our lives is the power of unconditional love. And it was those experiences that brought me to where I am now, which is I want to teach these concepts.
Wow.
Yeah.
Oof. That's quite an experience. But it touches me because on many levels, but it reminds me, my uncle was a surgeon, a thoracic surgeon in Belgium.
Oh.
And he was in practice for, I guess he started, at that time, it was his military thing that paid the school, and that's how he started. And he practiced till almost when he passed away at age 80, 81. And I went to visit him with my mom just the year before he passed away. And I asked him, what's the biggest thing that he would say to all healthcare practitioners? What's the most important thing of all his years of practice? And he said, it's love your patients. And I was just like, oh, it's recorded in French, but it's interesting. And it resonated so truly,
Right.
Interesting.
Well, the thing about the unconditional part of it is, if it's a pure unity, what I call cosmic unity, if that's a pure situation, there's love and then there's love, but love usually equals control. I love you, therefore I can control you, because everything is conditional in our society, in this planet. Everything is conditional upon meeting certain criteria, but in the scheme of things, placing condition on your love is really not love.
No.
It has to be unconditional. It has to be there no matter what.
Yeah.
And if the higher levels of awareness you achieve, the easier it is to practice unconditional love. But you have to be very aware of certain metaphysical concepts before you can take that into your habitual
Practice.
thought processes, you know, because it's your prominent mental attitude, or your prominent approach to life that determines if you're even capable of feeling unconditional love. And, you know, once you do reach that point, you find out that a huge burden has been lifted from your shoulders because, you know, the other thing I teach is our source. You know, what is our source? And our source is all from the same, we're all from the same source. Everything behind your house there, everything behind me, everything around us is from the same source. And it's a nuclear physics type knowledge that you must know about the Big Bang, how that worked, and why we all came from the same source. Therefore, we're all the same thing. Even, you know, it's like Native Americans used to teach that everything is spiritual, everything is one thing. And it's as a scientist, or in surgery, and as a scientist, I had to prove that before I could believe it. And so that's why I was tested many times as to why I would want to pursue those thought processes, because I had to have proof, you know, proof. And I think over 5 years of research, I came to the conclusion that I have the proof. I have it.
Interesting. Well, I have several thoughts and comments over you, but I think it's interesting how, I mean, and thanks for being so open, but you know, it's interesting how at first it's like that, the ego drive of not under my, you know, not under my watch, you know, it's like, no, this is going, you know, I'm going to make a difference. And it has all the, you know, all the power and force of, I've got this, you know. But what I also pick up in that is also that, you know, whether you were aware of it or not at the time, but it's this trust, you know, this fundamental kind of trust that there is, that you can, you know, and so can you talk a little bit about love and trust, like that universal love that's not attached and not control, that just is a recognition of this unified oneness, and the notion of trust, because I'm sure that's come through in your work, you know. Can you speak to that?
You know, once you reach a certain point in your journey up the levels of awareness, trust does not become an issue at all. What, you know, trust what? Okay, trust nature to be nature. You know, what I've determined is that nature is neutral. It's totally neutral. And, you know, we being the latest version of God's greatest vision, now there's a little phrase to think about a little bit. We are the latest version of God's great vision. It took 15 billion years to reach people like us that are human beings. It took 15 billion years of evolution to come to us, and we're the top, you know. So, you know, once you understand that, you know, what is there not to trust? First of all, on the pyramid of the sun, Jose taught me that there's no such thing as death. There's only transition. And, you know, at the top of the pyramid, which he got me up to, even though I was afraid of heights, you know, it was like a terrible thing for me. Halfway up, I froze, I couldn't go. And this man transmitted to me his feeling of unconditional love. And that's what was teaching me, you know, unconditional love. So at the top, you know, I said, you know, my life is crap. You know, I'm going to jump off this pyramid because I'm done with it, you know, done. So he said, well, Dr. Tom, I brought you here. If you jump, I got to go with you because I brought you here. Whether he meant that or not, I don't know, but I believed it at the time. So, you know, I assume he was trusting that my mental state would not allow me to destroy myself and him.
Mm-hmm.
So he had a certain trust right there, and he was radiating unconditional love.
Mm-hmm.
So, you know, when there's unconditional love, there's no other item, there's no other problem that needs to come up. You don't need to mistrust anything or
Mm-hmm.
anyone, because here's the thing. Let's say someone portrays your trust, you know, maybe a spouse or a good friend or something, they do something behind your back. The main thing that you must understand is you cannot judge them because you don't have all the facts.
Mm-hmm.
What did that person go through in their life that allowed them to be such a person? Was it their parents beat them up, ignored them, neglected them, abused them? You don't know. You can't judge someone and say, well, you're non-trustworthy, and so therefore I'm not going to trust you. Don't judge that. And don't judge anything. Just accept everything.
Mm-hmm.
And then you have no issues with trust.
Yeah. I think what I was feeling by trust is more because trust in and of itself has a duality. There is another if you're going to be in judgment and all this. And I wasn't meaning that trust. I was thinking of the what you captured when you said I can do it. And it's like a surrender type of, it's a trust. That's how I was seeing it. Like,
surrender.
Yeah, it's like, all right, it's all bigger than me. It's all, and that's that kind of, you know, and for you, it happened in a split second, you know, literally. And then from then on, it changed everything, you know, so.
Well, one of the things I want to point out about the ego, this is a real important lesson, because the ego gets a bad rap. You know, it's not the ego that's the problem, it's egomania. Egomania means, you know, making yourself number one or winning at the expense of someone else. That's egomania. But the ego was so powerful in our evolutionary journey that it caused us to survive many terrible things throughout history, that if we didn't have a strong ego, our race would not have survived. But so ego can be turned over and used in a positive way. You know, for example, my ego is fed when I help someone. That's just my orientation, you know. So I'm doing it out of my ego, but I'm not doing it out of egomania. Egomania is when I do crazy things because I'm hurting someone else so that I can be better or win or something like that.
Interesting. Yeah.
So there's two different aspects of the ego: egomania and ego force used for good.
Interesting distinction. Yeah. I'm going to shift a little bit to something that you wrote. I'm just looking at, where is this now? It just got my attention and I thought, oh, we need to talk about it. Sorry. Oh, it was about technology. Where did I see this? Oh, here. Quote, okay, our technological advances and talents are capable of keeping us alive far beyond our ability to enjoy the experience. And I just thought, I really would love you to explore that or share how that,
Well, what happens as we age, our diets and our lifestyle and our prominent mental attitude create inflammation in our bodies. I mean, we're all walking around with massive inflammation in our bodies. And the medical practice that we have today doesn't address inflammation, they address the symptoms that the inflammation is causing. So all the technology, the cardiac catheterizations, the open heart surgeries, et cetera, take care of these end problems, but do not take care of the problem. We're treating the symptoms, but not the disease. And so that's why I say that, you can have, quadruple bypass surgery and go home, but you're still full of inflammation. Your joints are still hurting. You feel tired. You're run down. And so technology has allowed you to survive, but not really live unless you go to the inflammation and get rid of the inflammation. And, you know, the unfortunate part of it is big farm, big ag, big hospitals, all these procedures are sucking up all the resources that we have for medical care and not solving the problem. Yeah. That's what I meant. That's what I meant by that.
Yeah, no, I was wondering if you meant it in a, I totally agree with that perspective, because it's true. It's like and as a surgeon, it's interesting because you're doing trauma surgery, which I think that's probably one of the places where it makes sense to go under the knife.
Right. Exactly. Right.
That many surgeries are removing organs that don't make sense to remove, that if you looked at, you know, with my naturopathic training, if you looked at the actual cause, you would never need to go that far, right?
Exactly.
You can, you know, treat the cause and then you don't have the organ damage, you know? So, yeah, no, I was also wondering if you were looking at it in a sort of a schism between our full potential as beings, and yet, you know, being kept, let's say, on respirators or kept on those types of technologies, whether you had any opinion yourself that from your years of experience, you know, like, I mean, in coma, they did not know that people were really actually able to listen, and now that research has come out. Do you have any understanding that you've come across in your own practice about these kind of life sustaining methods?
You know, it's hard to know what you really feel about that until you have an experience either in your family or your own experience. You know, how to judge that is very difficult, but because people, they want to cling to this thing that we call life. But, you know, I know, having faced death 3 times and survived for, I don't know what reason, but I did survive. Having experienced that and all the study that I've done about near-death experience and the whole thing, that it's irrelevant. You know, if you feel like you want to keep mom alive in that hospital for the next 3 weeks, although she can't function, then okay, it's your decision. You know, no one can make that decision unless you're in that situation. So to me, it's a non-issue in that it's such a personal issue that you can't judge how you would react, or, you know, like I would say right now that, you know, based on what I know about death and dying, that I'm not suicidal. I was at one point in my life because I wasn't aware to the level that I am now. So I've increased my level of awareness, and now I'm aware that there is no death anyway. Absolutely not any death. And, you know, there's so much evidence that points in that direction, and yet so much fear of dying, you know. So that's one of the things I'm trying to teach as well, because, you know, for example, the concept of reincarnation, which, you know, in the past I thought was just not a possibility. So, but I studied the neurophysics of it. I studied the neurology of it. I studied, you know, everything I could in the religious realm. And then I had some experience of my own. And I know that, that there's a certain consciousness that never will die. And our bodies are just a vehicle right now for us to experience certain, in a certain time frame, this particular universe. But guess what? There's infinite numbers of universes. So what's next? Let's go. I'm looking forward to it, you know. I mean, I'm going to do the best I can with the time I have left, but when I'm ready to go, I'm ready to go,
Mm-hmm.
you know? And I wish people could feel that way, because
Yeah.
death should be as a transitional situation. It should be a joyful situation.
Yeah.
Really, really.
Yeah, no,
Everybody wants to go to heaven, but nobody wants to die. That's the way it is.
yeah, no, it's interesting, because I have done a fair amount of reading, myself on this.
Yeah.
And I do feel that we're here for now, and we are still, onwards we go, right?
Right.
But it's interesting. I haven't been, though I do a lot of work on the body, like with the body,
Mhm.
as you did in surgery. It's there's a level of non-attachment that that also exists, so that it's almost like, yeah, you do everything you can, and then there's lines in which, again, it's letting go. It's like, what will be will be. There is a journey that you can't change or control. You come to it full-heartedly, but that's it, and it's interesting, because like currently, or not currently, it's been a while now, but I've had patients, and then my own mother, she goes, oh, if I'm in the hospital and they're going to put me on keeping alive, please, I've put you power of attorney, take me off. I don't want to be there,
Yeah.
And I'm like, I'm fine with that, but there's other family members, there's other people, and how do you, and sisters, and how do you convey that sense of trust? I mean, I call it trust, but I think what I mean really is probably surrender,
Right.
And when do you play God, as in, it's in your hands, it's no longer in their hands, because in hospitals you're hooked up. Like, you would have died naturally, but then you are there because that's where you are. So you can't deny that. So that's an actual reality. So what do you, any thoughts on that subject? Because I'm sure you must have come across it.
Well, I haven't.
You haven't? Okay, wow, that's amazing.
Well, I will say that, I can remember one patient, I had I never could understand why, I was called once in front of the medical board at the hospital, because I had a 0 complication rate and a 0 misdiagnosis rate on, say, like an example, appendicitis. Like, the national statistic is that you're going to take out 2% of the cases you do for acute appendicitis, you're going to find a normal appendix. And I was taking they said, look, you've had no negative appendicitis. That means you're not operating enough. I said, well, I don't operate unless I feel that the patient has appendicitis, and the process that I go through apparently works, because I have not opened up someone for no reason whatsoever and just called it a negative laparotomy, So, I really haven't experienced possibility of this death thing, except in one case. I had a case of acute pancreatitis that was extremely severe, and there was active bleeding. Just patient was going to bleed to death. So I took him to surgery, and no matter what I did, I could not stop the bleeding. There are conditions that happens called intravascular coagulation, and disseminated intravascular coagulation is a process where you start bleeding. So I said, okay, I'm losing my touch. Something's going on. This patient's bleeding to death, and we can't keep up with it. And so we stopped, and the patient was still alive, just by our respirator and everything else going, not really alive. But I went out to talk to the family. I said, look, I'm dumbfounded. I can't stop the bleeding. I don't know what to do. And she says, doctor, he wants to die. He told us, please don't do anything. I want to die. So I said, why would I go against that? You know? So I went back in, I said, we're done, close them up. And that's that. And that patient died.
Mm.
So that was one of my experiences with death that, you know, once again, it hurt my ego because I lost a patient and I wasn't used to losing patients. But, you know, it's one of the lessons that you learn, and that is that you cannot control everything. You know, you do what you can, and then you surrender, like you said. You do what you can. Use the tools that you have, and then surrender to the process.
Yeah, I know. That's...
You know, as far as the family decisions and so forth, I have no idea what advice to give on that. I just don't know about that, because every life situation is different, you know, and you have to think of so many variables when it's your mother in there, you know. And I lost my parents, you know, one to cancer and one to cardiovascular disease. And, you know, there was a decision to make, and, you know, we had agreed that after a certain point, my parents did not want to go into the hospital, period. If they were going to go, they were going to go at home. So we honored that, you know. I said, you know, Mom, this is getting close. You're getting bad. She says, that's no problem. I want to stay home. So it's such an individual thing that it's hard to give advice to anybody about that.
Yeah.
But I will say one thing. I got to say this one thing. You know, this is hard to realize because I get criticized for this all the time because I say everything is perfect. Everything is perfect. Everything is as it should be, regardless of how you judge it. And you can't judge it because you don't have all the facts. But you can have a trust in the force that from a little quarter-sized thing created a big bang, which created infinite universes. That's what you should trust. That power right there is what you should trust, not your human approach to various problems. You know, you do what you can and then you let it go because of the omnipotence of the Creator. If He's omnipotent, omnipower, omnipresence, omni-knowledge, omni-everything, and in my book I call that infinite wisdom. You know, infinite wisdom, if it's infinite and it's infinitely wise, how would a finite person like me, finite, ever challenge or question the infinite? So that's why I think that everything, no matter what it is, you know, and I have problems in my life that I have to counter every day, but after it's over, I sit down and say, okay, how is this perfect? Well, now you're going to question infinity. You just accept it and you go on. And I have found that every negative event in my life from the time I was tiny until now was designed to improve and enhance my own evolution. So everything is perfect. You can't tell me anything. You know, Hitler was perfect. Somebody will say to me, Hitler was perfect. I say, I cannot judge Hitler because I don't have all the facts. I don't know what made him that way. I don't know why infinite wisdom wanted the world to go through that. I cannot question infinite wisdom. If I do, then I'm questioning the power that created all this over 15 billion years of evolution. And why me, just a little guy sitting here in South Florida, how could I ever justify questioning that?
Yeah, that's yeah, and that's I mean, it's not just a good answer. It's really a way of looking at things too, because I mean, oh my gosh, you know, when you talk about suffering, actually, that's a subject I'd love you to talk about.
Suffering.
What is actually suffering? Because I mean, I have my version of what I believe it means myself, but what is suffering for you? And for me, it's like fighting against reality. It's creating
Yeah.
Yeah.
We suffer when we don't orient our thinking toward the big picture. You know, the suffering because of pain. Okay, well, first of all, did you do everything possible to avoid that pain? Or did you poison every cell in your body every day of your life by eating sugar and processed foods and meat that's contaminated with antibiotics and hormones, et cetera, et cetera? So the suffering is the consequence of you damaging your cells. So in that suffering, you could turn it around and say it's a learning process. I just need to, I feel a need that we have to change our paradigm, the paradigm that we have with medical practice. It's, okay, that patient's suffering, give them some OxyContin and they won't suffer. Okay, they'll die of an overdose later, but they won't be suffering that much. So why not say when you're 2 years old, let's stop feeding our children sugar, wheat, terrible foods. Let's keep them healthy so that they live a long, healthy life up to 125 years old and then go to sleep and go to the next phase of their life in another form. Why can't we do that? We have the knowledge now. We know what causes 90% of the diseases we have on our planet are preventable. And 90% of the diseases that exist are reversible without all these crazy procedures, spending billions of dollars. Our population, the last month of their lives, usually in the intensive care unit, hooked up to all kinds of stuff, spend more of our medical resources in that 1 month than we spend on them their whole life previous to that.
Yeah.
Yeah. And it's preventable. They're dying of preventable diseases.
Sorry about that.
Yeah. I don't know whether that answered any question or not.
No, it does. Yeah, I mean, if a person is, because I agree, things are preventable. And then we have this notion of old age and things don't work the way that they did. And I understand that all of that can be prevented as well.
Yeah.
And then there's sometimes it's not clear what it is. Like people, are eating the right diet. They seem to be doing everything right. How do you, and yet they have physical pain. How do you, and it's probably not your domain because as a surgeon, I don't know if you have those discussions post-surgery, but how do you approach that, like persistent discomfort that people might have physically?
Well, like if you take the perfect human being that has done the right diet, all this thing's perfect and there's nothing you can find in a diagnostic realm. You've boiled everything down, you come back with prominent mental attitude. In other words, we are taught that when you're a certain age, you're going to start feeling bad because your mom and dad did, and their mom and dad did, your grandma and everybody else, everybody around you is feeling bad. So if you reach 80 years old and you have nothing wrong with you, you have got something going on in your head that's based on your consciousness being able to, almost become what I call cosmic unity. Once you reach cosmic unity, all these concerns and questions become totally irrelevant. But the thing is, I don't know anyone that fits that category. I don't know anyone that's pain-free and disease-free, because every person that I've ever investigated is full of inflammation. Because if you sit them down and you say, okay, if you don't have arthritis, you don't have heart disease, why are you so miserable? And then you start delving into things like their lifestyle and diet and so forth. Just, for example, a recent research project demonstrated that older people that have arthritis and are walking in a walker and can't really get around, if they would just get out and walk, as far as they can walk and then go home. And they did that every day. And every day take 2 or 3 steps more than they did the previous day. Their pain will be reduced by 80% just by walking. And that's a proven fact.
Yeah.
So, I mean, there's always something you can do.
Mm-hmm.
Always something you can do. And of course, there's a lot of different theories that are well substantiated that all disease processes are caused by our own mental attitude. All disease processes, everything. There's some proof to that.
Yeah.
You know, cancer, everything.
Yeah. Do you have recommendations? I have one more question for you after this, but
okay.
Recommendations on, or could you maybe send, books, articles, things that that helped you in your journey, and as well, for people to find out more of the work you've done, because it sounds like you've taken the research and your own life experience, and now you're sharing this with the public as well, or it's really for healthcare practitioners?
Oh, I'm after everybody.
After everybody.
I'm after everybody.
Marketers must love you, right? Who's your general audience?
I think that I think that the thrust that I have right now is I'm thinking, how do I reach more people? And I'm thinking, if I can train a doctor, that doctor is going to have 4,000 patients. So I'm teaching one and I'm affecting 4,000. So that's why I'm leaning toward the doctors. Like in March, we're going to have a doctor's financial summit, because doctors are being abused. And one of the ways they're being abused is they don't know how to deal with money, and they don't make the money they're worth. They don't make the money they're worth unless you're a surgeon and you're working your butt off and you're sacrificing your life to do that. You might make some good money, but it goes away. It just, it's gone because you don't know what to do with it. You don't have the training to do with it. So I'm bringing in financial specialists. I'm bringing in ways to help these doctors, provide what the patients want, and more importantly, what they need. Patients want something, but that's not necessarily what they need, because you go in with hypertension, you don't need a pill to get rid of your hypertension. You need an explanation as to where that's coming from and what can be done to cure it without the medicine. So I want to cut out big pharma. I want to cut out, because all they're doing is making money. I want to cut out insurance companies because they're taking, insurance executives are taking billions of dollars out of the medical field that really should be used to compensate doctors for what they've been through and what they're doing. So I'm saying, look, you're worth a lot of money. It's time for you to realize that. And then I sneak in during all that my little things about the four aspects that I push, which would be nutritional excellence, physical superiority, financial abundance, and cosmic unity. Those 4 things is what I focus on, in teaching doctors to teach their patients, and then teaching patients the same thing. It's those 4 things. If you can understand those 4 things, then you're going to lead a long, healthy, happy life. And then the catch in this whole thing is, now that you're there, now that you understand, now go teach it to somebody. There is your purpose. Teaching that stuff to somebody, that's your purpose. You want to know what your purpose is? Your purpose is to learn something and then teach it. It's going to help somebody else. Your ego wants you to teach. So do it. Not egomania, not like insurance executives taking money from the system and building their mansions, their castles, but creating an increased level of awareness. Now, you ask about the sources. My one book, Living Above the Chaos, has a bibliography back there that tells you all these places where I got a lot of this knowledge. And a lot of it is not scientific books. It's metaphysical books.
Mhm.
There's some books written by cosmetologists. I'm not cosmetologists. You know, nuclear scientists
Mhm.
that have, because I had to prove a lot of this. So I got some books in there about that. But most of the books are metaphysical books from people like the Dalai Lama, you know, various people like that. A.J. Anderson, I don't know if you've heard of this, some of these people, A.J. Anderson, people like Neville Goddard,
Mhm.
amazing teacher, has book after book after book. If you go to Amazon and look up Neville Goddard, you'll be amazed at the treasure there of books that are metaphysical. And he taught during the 50s and 60s all this. He did lectures all over the country. Very few people have heard of him, but he has unbelievable insight into the way things work. So there's lots of sources out there, but that one book does it. Now I have another book called 12 Secrets of Radically Healthy People. And then I have another book, Unplugged for Good. In other words, stop seeing doctors. Get unplugged from our cultural and our societal influences. Get unplugged. It's called Unplugged for Good.
Mm. Yeah, amazing. Okay. Well, anyway, I have so many more questions for you. I'd love
Let's do it again sometime.
Yeah, absolutely. Yeah. And I was going to say, we're very much having come, you know, from different paths, but
yeah,
it's interesting because, you know, with the audience issue, I feel like my first book was What Patients Don't Say If Doctors Don't Ask. But it's really about creating that relationship where they know what's missing. The answers that doctors, the way they're trained, you know, could never even think of asking, basically.
Mm-hmm.
And then I have a new book that I'm just currently writing and putting together, which is How to Listen to the Body When It Speaks.
There you
Because
go.
I feel exactly right. It's the same, like unplug, first search within, search and do everything. And then, you know, again, that's why when we talk surgery, you know, yes.
Well, you know, the medical care system, this is where it's going. And, you know, I have a family doctor and, you know, I went over to see him once and just recently. I think I needed a yearly physical. And he walks in and he's in a hurry. He's like saying, "Oh, hi, Dr. Tom, how you doing? Blah, 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 blah." I say, "Ed, you know, where are you going?" He says, "I'm only allowed to spend 7 minutes per patient. I got to keep moving." So he now works for a company that allows him 7 minutes for patient. And how are you going to find out anything in 7 minutes? How are you going to have any relationship whatsoever? It's looking at the lab work, writing a prescription for the symptom, making the pharmacies rich, making the people that bought out his practice rich because you're seeing 100 patients a day, you know. I mean, so there's not going to be, in the future, there's not going to be a typical relationship between patient and doctor, you know, unless the doctors figure out how to handle
exactly.
this situation. Yeah.
Which I think is great that you're teaching also the financial aspect of it, you know, because if you look at scams and you look at all these things, the highest, the most frequent group of people scammed are doctors, right? Because they have a bit of money, but no management skills. They don't know what they're doing with that. And they're not thinking for the future because they're so in the moment of, you know, of helping in the moment, and they're not in a system. You know, I have quite a few medical friends, and it's.
Well, I have a little story that's just going to kill you.
Okay.
Okay. My wife the last 2 weeks ago, she had some abdominal pain, and you know, I kind of watched her, and you know, I'm a surgeon, so I look for those certain things, and you know, she said, "Yeah, it was hurting around here, and now it hurts on the right side down low." I'm saying, "Oh, so I got to start thinking about appendicitis." So I examine her and she had a little bit of tenderness in the right lower quadrant. Okay, so I say, "You know what? You know, I don't go to the hospital anymore. I do have a surgical clinic of my own where I do some venous work in the office here, but I don't go to the hospital. So I called the hospital and she says, well, yeah, we could see you, but it's going to take her 6 hours to get in here. So I took her to a urgent care center that happened to be operated by another hospital in West Palm Beach. So we went in there, and I met the doc, and I said, look, I just want a white blood count. I just want to see what her count is. If I knew what her white blood count is and noticed the patterns in that blood work, I would know if she's getting appendicitis or not.
Right.
He says, oh, I got to see her then, and she ended up having nothing. They didn't do a white blood count until later, but they did an MRI.
Ah, jeez.
When we left there, I got the bill later, $39,000 to tell her that she had a mild case of gastritis.
Oh,
That's where our medical care, $39,000. We were in there for maybe an hour, and they did an MRI and did this and this and this and this and this. You know, it can't be. I called back. I said, it can't be $39,000. It's impossible. Well, doctor, we're the, so that's where we're going. And where's that money going to? Not to the doctors.
No, exactly. Yeah. And it's worse, because in Canada, things are still covered. So it's not necessarily the end user. They're paying with their health. But they're not.
Yeah, because you got to wait in line 8 years for a hernia repair, right?
Yeah, and that's right, because they think that because it's free, that's, that's the solution, rather than actually going to see, naturopathic physicians, or, in many cases, things can be helped with all kinds of, therapies, especially pain. Like Bowen therapy works unbelievably well and gets people moving and pain-free. And it's like, why aren't they doing this first? Well, I know why. I mean,
yeah.
But it's interesting. Anyway, I don't want to take you any more of your time, but thank you so much. Yeah.
You're very welcome. Keep in touch.
Thank you for joining us at the Healers Café with Dr. Manon. For more information, go to drmanonbolliger.com.